Today we will discuss about paracetamol dose which is mainly used all over the world. The active ingredient in paracetamol is paracetamol. It's a simple analgesic, pain reliever and antipyretic fever reducer that works by blocking the production of prostaglandins in the body. Prostaglandins are the substances that cause pain and inflammation, and paracetamol's ability to block their production makes it an effective pain reliever and fever reducer. Paracetamol is available in various forms, including tablets, capsules, liquids, and suppositories, and it is usually taken orally. The strength of the paracetamol preparations can vary, so it's important to follow the constructions. Uses of paracetamol. Paracetamol is used to treat a variety of conditions, including first, pain relief. Paracetamol is commonly used to relieve mild to moderate pain such as headache, toothache, menstrual cramps, and muscles aches. Fever reduction. Paracetamol is effective in reducing fever associated with a variety of illness, including the common cold and flu. Paracetamol is also effective in arthritis, which help to relieve pain and stiffness associated with arthritis. Paracetamol is also used as post-operative pain to treat pain after surgery. Other uses paracetamol is also sometimes used to treat conditions such as back pain, osteoarthritis, and joint pain. It's important to note that while paracetamol is considered safe and effective when used as directed, it's not cure for the underlying condition and should be used in conjunction with other treatments as directed by the healthcare provider. Some brand name of paracetamol. Paracetamol is sold under many brand names. Some of the most common ones include Tylenol in USA, Panadol in UK, Calpol in UK, Feverol in USA, Datril in USA, Histamine in USA, Mapap in USA, Pedi in Germany, Sindol in UK, Lemsip in UK. There are just a few examples of brand names available for the paracetamol. The availability of different brand names vary depending on the country. Paracetamol also have some side effects. However, like all medication, it can cause side effects including nausea and vomiting, constipation, loss of appetite, diarrhea, skin rashes or hives, swelling of face, lips, tongue, or throat, breathing difficulties. These side effects are usually mild and go away on their own. However, it persists to become severe. It's important to seek medical attention. Taking too much paracetamol can lead to liver damage, which can be serious and even life-threatening. Sign of overdoses includes abdominal pain, nausea, and vomiting. If an overdose is suspected, seek medical attention immediately. It's important to follow the recommended doses and doesn't exceed the maximum daily dose of paracetamol, as taking too much can increase the risk of side effects and potentially lead to the liver damage. If you have any concern or questions about the use of paracetamol, it's best to consult with the healthcare provider such as pharmacist and doctor, etc.